Have you ever looked down at your hands and thought of your nails as, just cosmetic? Like a convenient canvas for polish, or maybe just a total annoyance when they break? Well, prepare to have that illusion completely shattered. Welcome to today's Explainer, where we're going to decode the incredible hidden messages sitting right there at your fingertips. See, your nails aren't just dead keratin. They're actually one of the very first places your body flashes warning signs of inflammation, hidden stress, and nutritional deficiencies. So today we're learning exactly how doctors diagnose nail issues, turning you into a much more informed observer of your own biology.
Okay, let's dive right into this clinical checklist we've got for today. We'll be looking at the body's health ledger, diagnosing shape and texture, decoding colors and spots, reading lines and ridges, and finally, making the final diagnosis.
Starting with Section 1, the body's health ledger.
To really get this, we kind of need to shift how we think about our nails. They are actually long-term historical records of your body's health. And what's really interesting about this is the hidden manufacturing center behind this record, the nail matrix. It's located right under your cuticle, and that's where new nail cells actually begin to grow. Think of it like a tiny factory. If your body goes through systemic inflammation, or if you're dealing with nutrient malabsorption, this specific matrix factory just slows down production, or honestly, malfunctions altogether. And those manufacturing errors, they show up much later right there on the nail itself.
And when I say later, I mean doctors have a very specific biological timeline they use to read your health history. Your nails grow exactly 2 to 3 millimeters per month. It's that slow, steady pace that allows your nails to capture those long-term trends, rather than just say what you ate for breakfast yesterday. It creates a literal physical timeline we can look back on.
Now, to keep that 2 to 3 millimeter monthly production humming along, the nail matrix requires very specific, high-quality building blocks. We're talking massive amounts of protein to make keratin, alongside iron, vitamin B12, zinc, selenium, and vitamin A. If there is a disruption in the supply chain of any of these essential nutrients, well, the matrix fails. And that leads us straight to the first physical abnormalities we're going to look at.
Moving on to Section 2, diagnosing shape and texture.
I'm going to invite you to literally hold up your hand right now. Take a close look at your nails as we walk through these three major structural issues. First up, spoon nails, medically known as koilonychia. This is where the nail misforms and curves upward, literally like a tiny spoon that could hold a drop of water. So why does this happen? Well, iron delivers oxygen to your nail cells. Without enough iron, often due to anemia or even celiac disease, they lack oxygen and just collapse into this shape. Next, if your nails are super thin or they flake off like tissue paper, your factory lacks basic building blocks. That often points to zinc or protein deficiencies, or sometimes hypothyroidism. Finally, look for nail pitting. These are tiny pinpoint imperfections. If you see this on multiple nails, it's actually a strong signal of autoimmune conditions, things like psoriasis, alopecia, or eczema directly affecting that nail matrix.
But hey, the nail itself isn't the only structural element we need to check. Look closely at your cuticles. They are literally the front door to your nail health, and you really don't want to leave the front door broken. If they're dry, cracked, or inflamed, it's a huge indicator of a vitamin C or omega-3 fatty acid deficiency. Protecting this front door ensures that the delicate nail matrix right underneath can do its job properly and grow out a remarkable nail.
Let's see how this builds in Section 3, decoding colors and spots.
Shifting our diagnostic focus over to visual hues and spots. I absolutely love this first one because we get to bust a massive, universally believed myth right here. Are those little white dots on your nails a sign of a calcium deficiency? Absolutely not. These tiny white spots, known clinically as leukonychia, are simply harmless microtraumas. They happen when you accidentally bang your hand on a counter, bite your nails, or honestly just type a little too vigorously on your keyboard.
So the crucial point is how doctors differentiate between something totally harmless and a major warning sign. Notice the difference between these two issues. Harmless white spots naturally just grow out over a month or two. But wide white bands spreading right across multiple nails, that is a completely different story. Bands can indicate low albumin, which is a protein made by your liver. This signals chronic illness, poor nutrition, or maybe a selenium deficiency. If these white marks stay fixed in the exact same place over months instead of growing out, you need to see a doctor immediately.
Now let's look at the overall color. Do your nails look rosy pink, or do they seem a little bit dull, maybe pale and washed out? Pale nails can be a very direct sign of anemia, whether that's from iron deficiency, blood loss, or low vitamin B12 and general malnutrition.
Let's actually do a quick interactive clinical test together right now to check for this. It's called the nail refill test. Press down firmly on your nail until it turns white, or what doctors call blanches. Okay, Now slowly release it. Count how many seconds it takes for that rosy pink color to return. 1, 2. If it takes longer than 2 to 3 seconds for the color to come back, that sluggish blood flow could definitely mean you have underlying anemia.
On the total opposite end of the color spectrum is a rare but completely unforgettable condition, yellow nail syndrome. These nails present as noticeably yellow, heavily thickened, and very slow-growing. Guys, this is not something a topical cosmetic cream is going to fix. It's deeply systemic. It's often linked to lymphedema in the lower extremities, lung fluid buildup, or severe thyroid disease. If you see this, it warrants a very fast trip to your doctor.
Okay, but what about dark streaks running down the nail? This one can be a little tricky. If you have darker skin, finding these streaks on a couple of nails is actually very common and usually completely benign. However, if a single dark streak appears, stays in one place, and does not grow out with the nail, well, it absolutely must be evaluated by a professional. It could be adrenal insufficiency, a B12 deficiency, or crucially, it could be hidden melanoma. When in doubt, always play it safe.
Section 4. Reading lines and ridges.
Looking at the literal lines drawn across our health ledger, let's first check for vertical ridges. These are the lines running from your cuticle straight up to the tip. If you have a few of these, don't panic. It's an incredibly normal sign of aging. But if they suddenly become highly pronounced across multiple nails all at once, your body is sounding an alarm. It usually means you're suffering from severe dehydration, chronic inflammation, or a serious zinc deficiency. Basically, you need more nutrient-rich foods and some daily moisturization.
Now, horizontal ridges are a different beast entirely. These are called Bowes lines. They are deep grooves running across the nail side to side. They show up when the nail matrix experiences a trauma so severe that it completely stops growing and then restarts later. It's actually a brilliant analogy from our source material. Think of it exactly like trees pausing their growth during a severe drought and then rapidly restarting when the rain finally returns. And this brilliantly illustrates the incredible diagnostic power we talked about earlier. Doctors can actually calculate the exact time of your past medical trauma using this. Remember that 2 to 3 millimeter monthly growth rate? Well, if you have a deep horizontal ridge sitting exactly halfway up your nail, a doctor can just measure it and know that roughly 6 to 8 weeks ago, you suffered a major inciting event. We're talking a high fever, a hospitalization, a surgery, or intense chemotherapy, something that literally stopped your body in its tracks.
And finally, Section 5, the final diagnosis. As we wrap up our mock clinical exam today, the source material shares a really profound thought from 1 Corinthians 12:18. But as it is, God arranged the members in the body, each one of them, as He chose. Now, whether you view this medically, biologically, or spiritually, the core takeaway is exactly the same. The human body is a masterfully interconnected system. Your nails do not change randomly. They are a perfectly arranged warning system reflecting the much deeper health of the whole entire body.
So, my fellow focus learners, here is your call to action. Please do not panic if you see a little ridge or a spot. Instead, use this knowledge. If you spot a white band, a deep horizontal ridge, or a persistent dark streak, take a picture to document it and consult your doctor. Your health is your absolute superpower, and protecting it always starts with observation. So, I'll leave you with this provocative question. The next time you look down at your hands, what is your body trying to tell you today?